High blood sugar occurs when your body doesn't make enough or effectively use insulin, a hormone that regulates blood glucose and helps it enter your cells for energy. Before watching the video, consider subscribing to my channel and clicking the bell icon to be notified whenever I publish a new video. High blood sugar or hyperglycemia is associated with diabetes. The Centers for Disease Control and Prevention (CDC) reports that 13% of adults live with diabetes, and 34.5% have pre-diabetes. This means close to 50% of all adults have diabetes or pre-diabetes. Here are some easy ways to lower blood sugar levels naturally. 1. Exercise regularly. Regular exercise can help you get to and maintain a moderate weight and increase insulin sensitivity. Increased insulin sensitivity means your cells are better able to use the available sugar in your bloodstream. Exercise also helps your muscles use blood sugar for energy and muscle contraction. If you have problems with blood sugar management, you should routinely check your levels. This will help you learn how you respond to different activities and keep your blood sugar levels from getting either too high or too low. Useful forms of exercise include weightlifting, brisk walking, running, biking, dancing, hiking, swimming, and more. 2. Manage your carb intake. Your body breaks carbs down into sugars, mostly glucose, and then insulin helps your body use and store sugar for energy. When you eat too many carbs or have insulin function problems, this process fails, and blood glucose levels can rise. Many studies show that a low-carb diet helps reduce blood sugar levels and prevent blood sugar spikes. It is recommended that people manage their carb intake by counting carbs and being aware of how many they need. What's more, a low-carb diet can help manage blood sugar levels in the long run. 3. Increase your fiber intake. Fiber slows carb digestion and sugar absorption. For these reasons, it promotes a more gradual rise in blood sugar levels. A high-fiber diet can help better manage type 1 diabetes by improving the body's ability to regulate blood sugar and reducing blood sugar lows. Foods that are high in fiber include vegetables, fruits, whole grains, and legumes. The recommended daily intake of fiber is about 25 grams for women and 38 grams for men. That's about 14 grams for every 1,000 calories. 4. Drink water and stay hydrated. Drinking enough water may help you keep your blood sugar levels within healthy limits. In addition to preventing dehydration, it helps your kidneys flush out the excess sugar through urine. One observational study showed that those who drank more water had a lower risk for developing high blood sugar levels. Drinking water regularly helps rehydrate the blood, lowers blood sugar levels, and could reduce diabetes risk. Keep in mind that water and other non-caloric beverages are best. Sugar-sweetened drinks raise blood glucose, drive weight gain, and increase diabetes risk. 5. Choose foods with a low glycemic index. The glycemic index measures how we absorb or digest foods, which affects the rate at which blood sugar levels rise. Both the amount and type of carbs determine how a food affects blood sugar levels. Eating low glycemic index foods has been shown to reduce blood sugar levels in those with diabetes. Although the glycemic index of foods is important, the amount of carbs consumed also matters. Foods with a low to moderate glycemic index include barley, yogurt, oats, beans, lentils, legumes, wheat pasta, and non-starchy vegetables. 6. Manage stress levels. Stress can affect your blood sugar levels. Hormones such as glucagon and cortisol are secreted during stress. These hormones cause blood sugar levels to go up. One study showed that exercise, relaxation, and meditation significantly reduced stress and lowered blood sugar levels for students. Exercises and relaxation methods like yoga and mindfulness-based stress reduction may also help correct insulin secretion problems in chronic diabetes. 7. Monitor your blood sugar levels. What gets measured gets managed. Measuring and monitoring blood glucose levels can also help you better manage your levels. For example, keeping track helps you determine whether you need to make adjustments in meals or medications. It will also help you find out how your body reacts to certain foods. Try measuring your levels every day and keeping track of the numbers in a log. 8. Get enough quality sleep. Getting enough sleep feels excellent and is necessary for good health. Poor sleeping habits and a lack of rest can also affect blood sugar levels and insulin sensitivity. They can increase appetite and promote weight gain. Sleep deprivation decreases the release of growth hormones and increases cortisol levels. Both of these play an essential role in blood sugar management. Furthermore, adequate sleep is about both quantity and quality. It's best to get a sufficient amount of high-quality sleep every night. Probably 6 to 8 hours. 9. Eat foods rich in chromium and magnesium. High blood sugar levels and diabetes have also been linked to micronutrient deficiencies. Examples include deficiencies in the minerals chromium and magnesium. Chromium is involved in carb and fat metabolism. It also helps regulate blood sugar levels. A lack of chromium may predispose you to carb intolerance. Some studies of people with diabetes showed that chromium had benefits for long-term blood sugar management. Chromium-rich foods include meats, whole grain products, fruit, vegetables and nuts. Magnesium has also been shown to benefit blood sugar levels, while magnesium deficiency has been linked to a higher risk of developing diabetes. Studies have linked individuals with the highest magnesium intake with up to a 47% lower risk for developing type 2 diabetes. Magnesium-rich foods include dark leafy greens, squash and pumpkin seeds, tuna, whole grains, dark chocolate, bananas, avocados and beans. 10. Try apple cider vinegar. Apple cider vinegar has many health benefits. It promotes lower fasting blood sugar levels, possibly decreasing its production by the liver or increasing its use by cells. Furthermore, studies show that vinegar significantly influences your body's response to sugars and can help improve insulin sensitivity. It may be mixed in a few ounces of water that you can drink before a high-carb meal or be mixed in salad dressing. However, it's essential to talk with your doctor before taking apple cider vinegar if you're already taking medications that lower blood sugar. 11. Experiment with cinnamon extract. Cinnamon is known to have many health benefits. It's been shown to improve insulin sensitivity by decreasing insulin resistance at the cellular level. Studies show cinnamon can also lower blood sugar levels by up to 29%. It slows the breakdown of carbs in the digestive tract, which moderates the rise in blood sugar after a meal. 12. Try berberine. Berberine is the active component of a herb used in traditional Chinese medicine, that is used in treating diabetes. Berberine has been shown to help lower blood sugar and enhance carb breakdown for energy. What's more, berberine may be as effective as some blood sugar-lowering drugs. This makes it one of the most effective supplements for those with diabetes or prediabetes. More high-quality studies are needed to determine its safety and effectiveness. Additionally, it may have some side effects, such as diarrhea, constipation, flatulence and abdominal pain. Speak with your healthcare provider first if you're considering using berberine. 13. Eat fenugreek seeds. Fenugreek seeds are a great source of soluble fiber, which can help manage blood sugar levels. Many studies have shown that fenugreek can effectively lower blood sugar in people with diabetes. It also helps reduce fasting glucose and improve glucose tolerance. Although not that popular, fenugreek can be added to baked goods to help treat diabetes. The recommended dose of fenugreek seeds is 2 to 5 grams per day, although this varies from study to study. 14. Maintain a moderate weight. It's a no-brainer that maintaining a moderate weight will help improve your health and may help prevent future health problems. Weight management also promotes healthy blood sugar levels and has been shown to help reduce your risk for developing diabetes. Even a 7% reduction in body weight can decrease your risk for developing diabetes by up to 58%, and it seems to work even better than a common diabetes medication. It's important to monitor your waistline, as it's perhaps the most crucial weight-related factor for estimating your diabetes risk. A measurement of more than 35 inches (88.9 centimeters) for women and more than 40 inches (101.6 centimeters) for men is associated with an increased risk of developing insulin resistance, high blood sugar levels, and type 2 diabetes. Having a healthy waist measurement may even be more important than your overall weight. Be sure to talk with your healthcare provider before making lifestyle changes or trying new supplements. This is particularly important if you have problems with blood sugar management or if you're taking medications to lower blood glucose levels. If you have diabetes or have blood sugar management problems, it's important to work with your healthcare provider to create and start a treatment plan as soon as possible. If you like this video, give it a thumbs up and share it with your friends. For more videos of this kind, please consider subscribing to the channel. See you next time.